makes most women start a business? Is it passion, money, or freedom? Welcome to Female Founders, the podcast that takes you behind the scene with women who are founders and CEOs to help you start and scale a successful business of your own. I am your host, Nagelia de Ravin.
Hello everyone, welcome to another episode of Female Founders. In today's episode, I have the pleasure of speaking with Jacqueline Cruzado and Alison Jordan. They are also known as Jackie and Ali. Jackie is a seasoned public health expert with over 30 years of experience in correctional health, disease prevention, and program management. Bilingual and a dynamic leader, she's greatly contributed to community health across the U.S. and Puerto Rico. Ali, with 25 years in public health leadership, has profoundly impacted correctional health system through innovative programs and interventions. Her work in transitional care coordination and overdose prevention in New York City jails showcases her commitment to transformative health solutions. They are the owners of ACOJA Consulting. Good morning, Jackie and Ali. Thank you so much for joining me today, and I'm looking forward to learning more about ACOJA Consulting and all the great work you both have been doing. And you two are two amazing ladies, and I look forward to it. Jackie, could you share with us the story of how you venture into the field of correctional public health and what motivated you to pursue this path?
Well, in the 1980s, I joined the New York City Health Department. They have gotten a CDC grant to do HIV health education and prevention. And I started doing community work first. And then I realized that there was no one going into the jails, and there was an opening for someone to go into the facilities, into the jails of Rikers Island. And I signed up for it, and I went into corrections. And then after a year of doing both community and correction, I decided that my best work and where I could make an impact for the people that we serve were people that were incarcerated. So I stood in corrections.
But why corrections? Like you're dealing with people, don't get me wrong, sometimes they are innocent too, but sometimes they are not, But why would you want to deal with people like that, especially the one that commit crimes or do really, bad things?
Well, so remember that anyone that goes into correction, unless correction is for detainees, they're not sentenced yet. So For me, everybody's innocent until proven guilty, right? So there is only one facility that was sentence facility, and there were a year less city time. So to me, that didn't impact me because I don't know what crime, when I went in there, I don't know what crime they committed, and I really didn't care what crime they committed. My work was to go and educate. At that time, HIV was very rampant and people were dying, and we needed to do something to the population in jails because that same population is the population that we have in our communities. So they go to jail, but they come out and they go right back to the communities that we serve. And in the community, you don't know who committed a crime or not.
That's true. But now, when you say that you go and you educated them, can you with the program, is it some kind of like, don't do this and don't follow this, you need to go check up, things like that? How does that work? How is that working really back then?
So at that time in the 1980s, all we did was prevention education and condom distribution. Well, we didn't do at that time condom distribution, but we were talking, about condoms. We were more concentrating on cleaning a set of works with bleach. We're talking in the 80s. Remember, it's the beginning of HIV. People didn't know, and we just had to educate everybody that it was a spread. The way was not spread. And then it was just going into the housing area where the incarcerated population actually slept. We will go in, me and a partner, 2 people. We'll go in and then we just do education and we give out pamphlets because at that time, that's what the only thing we were allowed to do when we went into correction facilities. Remember, it's the Department of Correction and the New York City Department of Health that got together for us to be able to do this work.
But there was no testing at the time.
No, there were testing, but not like that, right? So we needed to educate everybody, because we knew they were coming out. So we needed to educate the population. And I got to tell you, it was one of the best work that I've ever done. I think that we met the clients where they were at, and we educated where they were at. Everything was all about them and how we can help you to stay HIV negative. And not only HIV, but we talked about STDs, we talked about hepatitis, syphilis, gonorrhea. And we educated everybody. What was the difference between a virus and a germ? What was it was just different. It was really, really beautiful, the work that we were doing then.
And then from there, you just decided to continue with that?
So I thought about it. I thought about, I figured I moved up. Instead of a staff, now I was a supervisor. And I just kept on moving up in the health department. And when I was a supervisor, now I had different, of course, my rules and everything changed of the job. But now I was able to go in as an educator. Now I started to educate the officers, educate the warden, and educated everybody in the facility, not only the incarcerated population. So now I was in charge of the whole facility, the whole jail that I was in, and educating everybody through roll call, through the anywhere they were at lunch. At the lunchroom, I used to put tabling where I would give out pamphlets to the officer, educate the officers too, because they go back home too. And they have their loved ones. So we needed to protect just everybody in general. So my job as a supervisor was to make sure that I educated everybody in that facility, whichever facility I was in, and also to make my connections with the warden and with everybody else, so like that we could continue doing the great work that we were doing. So a lot of relationship building, to be honest, when I was in corrections. And actually, I probably shouldn't share this, but I met my husband in jail. I tell everybody I met my husband in jail, but my husband was a correction officer too.
When you said I met my husband in jail, for people.
Everybody.
So what was he in for?
Yeah, exactly. But he was a correction officer. So working in jails did a lot of good for me. I helped a lot of people, and I found the love of my life
there as well. So now, Jackie, you are the CEO, and Ali is the Chief Administrative Officer of ACOJA Consulting. But I'm curious to know, how did you two meet and decided to start ACOJA Consulting?
I'm going to let Alison answer that because she's got a good one.
And I wanted to remind you, Jackie, that you got the first condom distribution policy in the entire country available in New York City jails and Rikers Island. And remember that the people who are in jails are detained waiting for trial. So most people, if you have money, you're detained awaiting trial in your own apartment and you still get to keep your job. But if you're poor, then you wind up in jail and you don't get to keep your job. And then you could be sitting for years waiting for your trial and everything to be resolved. And so more often than not, what we run into, I would say more than 90% of the folks that we run into are there because of what we consider, crimes of poverty. So people don't have enough to eat. They don't have a place to sleep. It's really not what people think when you say Rikers Island. It's like, oh, there must be some really mean, bad people there. And I'm not saying there are none, but that's not really what that's not our population. That's not really what people experience if you work in the jails, for the most part. So I had a long history of being a caseworker. I knocked on a lot of doors. So I worked in a daycare center. I feel like some of the kids that I served in the daycare center must have been incarcerated at some point later in their lives, just because the prevalence in the communities that we serve are very much aligned with poverty. We've got all kinds of maps that show really what you find in the jails is the people that have the lowest socioeconomic status, that have the highest rates of fill-in-the-blank disease, asthma, diabetes, heart disease, hypertension, substance use disorder, whatever is ailing your community, you will find a higher rate of it in your carceral facilities, particularly in your jails. And so I knew that from It was over 20 years at the time, and retired it with 39 years in city government. So this is a lifetime of 2 careers here. But what I was charged with, I came into the health department after spending most of my time in the city's Department of Social Services, and I was asked by the leadership, which at the time under the Bloomberg administration was Tom Frieden, and he said, see if you can replicate the Hampton County model from Massachusetts in New York City jails. It's a public health model for correctional health. It's still active, and we're actually friends now with the people that started it because we were fangirling one day and got to meet them. But so we worked to take this model and replicate it in the New York City jails. But while we were investigating to see what resources we had available, we found out that there was this team that actually Jackie was running. We didn't know it at the time, that were already in the jail. So we said, well, why don't we start with the people who know what they're doing here and bring correctional health and public health together that way. And so everyone who was working in the jail was invited to a meeting. There was not a lot of people who were interested in working with correctional health. They wanted to stay doing what they were doing. But there was one smiling face in the room, and that was the day I met Jackie. I don't even know if we spoke, to be honest with you. But she was doing that, the same face she has on now. And so I looked at the room, and we said, well, you know what? This was union represented employees. We're going to give everybody a chance to look at these different positions. One was similar to the work that they were doing. One was out in the community doing work in the health centers. And the third was to stay part of this new program. And so people picked their choices, and we went in seniority order. And everybody got their first or second choice except Jackie, because she wanted to leave. And I had to call her up and say, I'm really sorry, but I can't let you go. And she said, well, why not? I want to try something new. I've been doing this for a while. You know, I'd like to learn. I want to do more. I said, well, you're going to do all of that and more, because you're going to work with me, and we're going to be a team, and we're going to put this together. And that's what she wasn't sure at first, to be honest. It was a hard pitch. I had to. And so then we took the Hampton County model. We were sitting in my office in the basement of some building, and I said, yeah, they were. You don't want your office below grade. I'm just saying. So we're sitting in this office, and I said, so here's a Hampton County model. Do you think we can do this in Rikers Island? Even the person who created it didn't think it was built for a jail system as big as ours. And so she looked at me straight faced, and she said, yes. And no equivocation. No, I don't know. We'll see. What do you think? Nothing. Just straight out flat. Yes. So I'm like, well, how? So she starts talking. Now, one of the things you'll know about us quickly is that Jackie is an auditory learner. But if I don't have a pen, don't talk to me, because I'm completely visual and operational. So I'm literally sitting here with a pen making doodles so that I can hear what you're saying. So I'm like, well, wait a minute, because I'm not going to remember this. So I get out a flip chart, with the flip chart with the sticky notes. We didn't even have a stand. We just went around the room and kept sticking them around. We went around the room 3 times. Yeah. And we wrote the model. So the model that you'll see on our website, the Tools and Tips Handbook, was actually the outgrowth of that first session. And we brought the teams together from a lot of different ways, both in the jail, our teams, who worked in corrections, people who worked in correctional health, and most importantly, our community partners. So we had 4 community partners: the Fortune Society, Exponents, Palladium, and Women's Prison Association, who were already pushing into the jail and serving people. And so technically they were competitors, but we didn't care, because what we wanted were the people who were doing the work. And then we asked them, well, who do you work with? And then we wound up with TASC and EAC and the courts, and we wound up with DAs who were in the room. And then we had people from the courts, and everybody had different, it's like when you talk about the analogy of the elephant. and some people, but you can't see. And so some people grab it and they think it's a snake, and somebody else grabs another section. They think it's something else. And it was like that. And so when we got all the parts together, then it was clear that there was an elephant in the room, and that the only way for us to work with this entire elephant in the room was for us to all work together. And then Jackie actually facilitated getting documentation. Because one of the challenges, they were all fighting with each other. They were really they were fighting while we were there. We had some crowd control, but it was at the health department office. So there were, and not fighting like fist fighting, but saying, well, you don't do this and I don't do that. And we're like, well, why is that? Why don't you do that? And so it turned out that the attorneys were requesting medical charts in order to get the documentation that people needed for the treatment programs outside. So mental health, substance use treatment, also medical care and treatment, in order to get the records from the jail. They were, and place people in programs that were alternatives to incarceration, which we wanted. It turns out that you needed, they were requesting medical records. Well, requesting medical records takes a very long time. This is not a thing that happens in less than a couple of months, even in a very well-oiled machine operation. And then you're getting cases and cases of really protected health information that people probably wouldn't want just sent around, right? Because it's not a medical provider. You're sending it to the courts. You're sending it to the district attorney. You're sending it to people that can impact your legal case. And they could be using some of the information for reasons other than the stated one. So Jackie says, well, what do you need? And so she went around I wrote on the board because, I have to hear. And she asks everybody, what pieces do they need in order to get it? So she goes through the list and she looks at me. She says, Allie, everything that they need is on the screenshot for the medical summary. It's one piece of paper. And then the only other thing they needed was the results of a TB test to prove that the person could be in a congregate setting. And so it was 2 pieces of paper. So we worked it out that if the patient wanted to go into a program, they signed the consent for us to give it to their attorney, and their attorney would then send it to whoever it was that needed it in order for the placements to grow. And the number of people that were released from jail and placed into court programs, so programs that are overseen by the courts, went up by 20%. Wow. So we saved lives, we saved money, we got people into the right programs, and it took a village.
And the 2 of you get to meet.
And the 2 of us got to meet. And so we worked together for a number of years. I retired in February of 2020, the best planned retirement ever. The week after my retirement party, the place was shut down, COVID. It was really bad. And then we did our first community collaboration after being a COHA. So you can see the result of that is also posted on our website under COVID-19 Collaborative. And I said, well, Jackie, what are we going to do? Because all the people we worked with were now literally, in COVID, just complete SWAT. The whole thing was bad on every level. And our former the medical director there, my former supervisor and colleague, Ross McDonald, went on Twitter and he said, there's a cruise ship coming. I know where I'll be. What will you be doing? And he wasn't writing it to me, but it felt personal, right? Because I know the guy, right? And so I said, well, Jackie, what are we going to do? Ross needs our help. What would we do if we were there? Because you can't meet in person, like the whole thing. Yeah. And she said, well, we'll do what we always did. We'll get all our people together. I said, well, I have a Zoom account. You think we could do this on Zoom? She goes, why not? I had never run a Zoom meeting before in my life.
Now you are.
And so we brought, and then I said, but we should have some panelists. She goes, yeah, that'd be good. Have some people that know stuff and who can give information to them. Because we didn't want just for them to complain about what was happening. We wanted to find out what they needed and see if we could provide it. So we got Bobby Cohen, who's at the Board of Corrections, and Homer Venters, all our public health gurus that we could get to be on the phone that weren't otherwise doing other work. the head of the NASW social work committee on correctional health stuff. We had all kinds of folks, four panelists. And then we had 46 of our community partners join. And then we used a polling system that we used through RDE so that they could give us feedback, because it was so many people that it was hard to have 50 conversations. And and we found out that the number one thing that people needed when they came home was food.
And shelter.
So we as a society should stop trying to prove that Maslow was right and just understand that basic needs are food, clothing, and shelter in that order.
And that's true. You are right.
Yeah, we should just assume that it's necessary. We would offer for folks who were coming home T-shirt, towels, socks, and underwear under Ryan White PCNs. It's available to provide people with personal care items, and so long as the T-shirt and the underwear are plain white and they don't have fancy logos on them, they're not considered clothing. They're considered personal care items. And so we were able to get that clarification and gave out tens of thousands, maybe 100,000.
Yes, especially while they were incarcerated.
When they were incarcerated. And then when they left also, so we had a personal care kit that would go home with people. Sometimes we'd give it to the visitors so that they would have it. We did naloxone training when the opioid epidemic was in its peak with the health department staff. They trained us, and then we trained our staff, and that continues today to give support to visitors, including intranasal naloxone kits and personal care items and condoms. That continues today. Yeah.
You are doing just amazing work. But now you too started ACOJA Consulting. So can you tell us a little bit about ACOJA Consulting and the services it offers? And how did you come up with it?
When we were working together, we thought about it. We were talking about it. And I was just telling her, like, I'm going to be tired. I'm going to leave. And she's like, me too. And then, then we just decided, well, we do great work together. Why stop the work that we're doing? We complement each other really well with the work. What about if we start our own, consulting? And I was like, all right. And then I left before she did. I retired before Alison did. So I went on my own and I started the consulting, but I started on the Jacqueline Cruzado Consulting. And I just put a placeholder card until she was ready to go. And then when she retired, that was it. We changed the name, and instead of Jacqueline Cruzado Consulting, it was ACOJA Consulting. It was the only one that I could agree on, the name.
So
there was a reason why, though, because it had Alison Jordan's name on it, and it had Jackie in it. So if you look at the word ACOJA, it has both our name, and it also means embrace and welcome in Spanish. So I said, that's exactly what we love to do. We like to welcome people to join us in the fight that we're in, to help other people. And it has both our names. So I thought it was, some people like the name, some people don't like the name. Some people call it ACOJA, and I'm like, no, you're messing it all up.
We answer any which way people say it. And so I'm Alison O Jordan, and Jackie is Jacqueline Cruzado. And so I was just playing with the letters of our name and trying to make something that looked pretty as an anagram, really. And then Jackie's like, but it's a word. I'm like, what do you mean it's a word? I didn't know it was a word. And she goes, yeah, that's good. I'm like, she says, it means something. And I was like, it means something. She says, yes, it means to embrace. And we always wanted the sun, because we feel like the sun, it gives us energy. It moves us forward. The sun is always something. And then we talk about opening doors to make a difference. So that works with jails, but it also works in life, right? So people get stuck if you open a door, a window, all those kinds of things. And so we have those little bars on the side to represent, the doors are open, come on in. So it's in embracing and welcoming at the same time. And that's how we operate. We work with people that we know are doing good work, people that, when I was working in, child welfare and in the social service agency, there were a lot of organizations that grew up as kind of mom and pop, people who really cared, but they weren't necessarily equipped to deal with the administrivia of working with government. And so I always felt like, and there's a place where you can get away with that for so long, depending on how much funding you get, but there's around the 18th year of an organization, somewhere like in your teens, there's a change that has to happen. And that's always been the sweet spot for me in terms of when an organization knows enough, but not enough to do the small work, but not enough to step into the big leagues. And so often they would get enticed by these RFPs that would come out and they'd say, oh, well, we have all the qualification requirements. We can do it. But then there's things that happen to organizations, like they have to get $1 million in liability insurance, which is fine. The banks will give it to them. But what they don't tell you is that if for some reason government doesn't pay on time, as happens all too often, then you have to use that insurance to pay your staff. And the bank will charge you interest.
Of course.
But the interest is not covered by the government contract.
Of course not.
So you need to fundraise for that and you need to be prepared for it. And so organizations that have done this for a long time know that, but they're not necessarily sharing with the up and coming, one-off mom, small businesses. So we really want to level out the playing field and to help organizations do that, as well as expand and enhance the models that we've created with other organizations to make that happen, just like Jackie did in Puerto Rico. Jackie, get a little closer, I think, and then share a little bit about One Stop Career Center and walking. I feel in my mind's eye, Jackie walked across Puerto Rico to identify all the right fit doctors. That's in my mind. She just walked across the island of Puerto Rico.
Yeah, well, it's just it started with us again applying for a grant, right? For a SPINS grant, the Latino SPINS grant. And this grant, our population that we wanted to put every Latino in the grant. However, they told us no, we could only do the Puerto Ricans. It was Mexican or Puerto Ricans, right? And of course, New York City, we're going to do the Puerto Ricans, right? Because California got Mexican and Texas got Mexican, whatever. But anyway, so we're sitting there and I'm looking at her and I'm saying, okay, so I have a whole bunch of people that I knew that I interview, and that I also know that these particular clients will leave to Puerto Rico. And they go for 2-3 months and then they come back. Because remember, they live in New York City, but they leave, I don't know, January, like I do, January through February, March, April, whatever. And then they come back for vacation.
Yeah.
So I said to Alison, I said, I don't know how we're going to do this, because what if somebody wants to go home? They want to go back, because we always go to motherland. We love our motherland. We keep in touch with the people that are there, our family, our loved ones, right? So then Alison said, yeah, you're right, Jackie, how are we going to do that? So then I said, I don't know. We asked people don't know other organizations in Puerto Rico. And we were like, that cannot be possible. I know there's organizations in Puerto Rico that are doing great work. But anyway, so Alison decided on LinkedIn to put out a post, we need somebody for Puerto Rico. And of course, who answers the LinkedIn? It was Carmen Cosme from One Stop Career Center in Puerto Rico. And Alison says, here, Jackie, call Carmen. She's in Puerto Rico. And when I started talking to Carmen and see what she did, I said to myself, wow, this is exactly what we need. We need housing and we need employment on top of medical. These are the things that we need.
They were like sisters from day one.
So we got together. I got to tell you, Thanksgiving we came. I called her. She was here before Thanksgiving, that year. I picked her up. I took her to Rikers. I told her, this is the population we're serving. How could we make this work? And sure enough, then after that, the holidays passed by. I fly to Puerto Rico and literally start working with Carmen. And we visit every FQAC, every Ryan White clinic, every single clinic that I knew that I would send any part of my family and my sister, my brother, whoever, to this clinic, because I knew the clinic was good and the staff was great. And that's how we did it. And then Little do we know, we applied for another grant, which is the workforce. And then I said, okay, Carmen, I need your help. And so we replicated transitional care coordination in Puerto Rico.
This is amazing.
We went to the jails, and Alice, I could tell you, like, the numbers that they have for the connections to care were amazing. They did better than us on the jail linkages.
Because they were a housing and employment agency, and we pushed in the HIV counseling and healthcare linkage to an organization that was already providing people with education during their incarceration and housing on the time of release. So they already had relationships, and we realized that it was so important not just to connect people to primary care and services for HIV, but also to connect people. And really, it doesn't matter the disease. Honestly, you could cross that. It's the same model. The Hampton County model was for all chronic and communicable diseases. And our original model was also the same for chronic and communicable. The funding that we got to evaluate it came from the Ryan White community. But the service model doesn't change. Just cross out one disease and fill in the other. I mean, there's some, disease specific things, but the general model stays the same. And then, so they did such a good job in Puerto Rico, and replicating the model that we were asked by HRSA to then train other jurisdictions to see if the model could be replicated, because there were a lot of people who were calling it the Jolly factor. So Jackie and Allie, they merged our names together.
Yeah.
And so, and then it autocorrects to jail. The whole thing is very strange to me, but so they were calling it the Jolly factor, the researchers, because they're like, well, we don't know whether or not the model would work if you don't have the Jolly factor. So they said, well, let's test it out. So we trained 3 sites through another SPINS initiative, dissemination of evidence-informed interventions, and Raleigh, North Carolina, Camden, New Jersey, and Clark County, which is where Las Vegas is in Nevada. And all 3 sites were able to replicate the model. The outcomes for viral load suppression, that is that everybody's taking their medication and doing it in a way that's making it so they have non-transmissible HIV, were even higher than what we found in New York City. And they did that by linking people to care. They had a little different measures here and there because it was a different evaluation, which was good, right? Because then we're showing, well, we're going to look at it this other way. We didn't do it exactly the same way. We didn't replicate it the same way, but we got the same kind of great outcomes. And so those jurisdictions are still reach out to us. And then there was another jurisdiction we've worked with, Paterson, New Jersey. There's others out there now that are also looking to replicate the model, and we very much like to just spread it all over the country. It's necessary, yeah. And one of the things that recently we were able to do was participate in the SAMHSA, the Substance Abuse Mental Health Services Administration for the government. They have a GAIN center where they teach people how to teach curriculum. So we were trained by the GAIN center to teach trauma-informed training for people who work with the criminal justice population. So not for the population itself, but for the people who work with them, either in the jails or in the community. So people who are in security, people who are in social work, people who are in treatment services, whatever they need. We're authorized to offer that service, that training. It's a beautiful curriculum at no cost. So that's something that ACOJA offers. I'm waiting for the first taker. I will let you know if we get one. It's intense, right? So it does require a lot of one-on-one. We're in some conversations with organizations, but what we'd like to really do is to share both models. So to share the transitional care coordination model, which Jackie and I would do together, and explain how, and think about with them, do a functional assessment for each jurisdiction to see what they need. Because sometimes they have a lot of it and they only need 1 or 2 things in order to make the model work. And sometimes they need a little more. But for the most part, folks are doing some parts of it, but not necessarily putting all the collaborators together, which is really key. And so we just like to spread the word, and we so appreciate you offering us this opportunity to share, who we are, what we do, and know that when you hire the two of us, you get more than the sum of our parts, because we don't think alike. We don't come from the same backgrounds. I have very traditional, liberal arts college education. I went to Hunter College School of Social Work for my master's degree. Jackie went to the School of Hard Knocks. She learns on the ground and in the field, and her lessons come from people with lived experience, which I would never see on so many levels, would never touch me. And so when you get the two of us, then there's a little thing that's this little magic. We call it the Jolly factor that, well, we don't, other people do, that when we put our minds together, we create things that we couldn't have created alone.
Oh.
And that's really the benefit. I think our partnership really illustrates the benefit of working in a collaborative way, because you pick partners that don't necessarily do things exactly the way you do or with the same focus that you do, but you can learn from one another. And where those things connect, I'm doing this with my fingers, where these things connect, that's where the magic happens.
Exactly. And I think when you two work together too, the fact that you get along so well, that's make things move a little bit, how would I say that better? Also make it like, the clients get more as well out of it, because like you said, the background is different. So you have two different type of point of view that's always coming together. And usually we need that, because if everyone think the same, then nothing gonna move forward. Yeah. But if we think differently, then it's easily to come up with different things and be able to put them two together and make it work in a perfect way.
Yes. And it is so true that people tend to stay in their bubbles, in their silos, people tend to hang around with, people who same thing as them, or who come from the same communities, or who speak the same language. And, I wasn't taught to do that. I was taught that there's great, benefits to me to learn what other people in other communities do. And my mother was very afraid that I was going to get like that, because she grew up in the Bronx, and she didn't want me to get like, too much like a Long Islander. I have the accent a little, but she didn't want me to adopt that kind of privileged attitude. It was very clear that I didn't have the right to my privilege. I think my mom was an anti-racist before Kendi started writing it, but the reality, yeah, I think so. But the reality was, her first friends looked more like you than either of us. She didn't have any pink people in her life as people her age until she was in middle school. So yeah. So she would yell at her dad, who was very much like Archie Bunker, like, be good, my friends are coming over. Anyway, so I was taught that I had privilege and that I didn't get to take credit for it or to benefit from it, but that it was my responsibility to use that privilege to help people that didn't have it. Yeah. So so then when you go into jail and you see all these people who don't have the privilege, because frankly, I would never wind up in jail for stuff that people that wind up in jail for. It would just not happen. There would be money to bail me out. There would be somebody's house. There would be, there's things that are just not fair in our society. And so that's, we're really trying to combat that, isn't it?
Oh my goodness.
So
my other question, do you guys have any big projects or anything you guys looking for to the future that you guys are working on right now?
Which one, Jackie?
Just say everything.
We have some things that are not ready to be disclosed yet, so stay tuned. But we continue. We just finished a project, hepatitis C data to care, also facilitating in Puerto Rico with Yale University. We also have worked on projects with apt associates where we assist with evaluations. We've worked with I'm trying to think. some of the others, we've done a lot of mapping in terms of identifying where organizations can benefit from collaborations. We've done. I'm also teaching, just so you know, at Hofstra University. I have MPH students teaching policy, program planning, and evaluation. We have a packaged training for organizations that want to teach their teams how to participate in grant writing instead of just hiring a grant writer, which you can do, but how that really requires collaborative approaches if you're going to be successful. We have a course on that we offer to other businesses. Really, our approach is to work with organizations who are doing good work, and they don't have to be involved in the criminal legal system at all. That's not really, that's where we fell because Jackie was looking to make the biggest bang for your buck. So if you want to find the largest concentration of people with health conditions, with substance use issues, with fill in the blank, it doesn't matter what it is, you're going to find them in your local jails. Now, that doesn't mean that everybody's going to have access, but it does mean that if you're building a collaborative, they should be at the table.
So now, Jackie and Ali, how can someone reach out to you, especially the company, to work with the company?
So yeah, that's simple. Just go to our website, www.ACOJAconsulting.com. There's contact us page. You'll get free tools and tips and resources, and then just give us a shout out. And we also have a phone number, which I will give to you for your audience, which is 929-319-3456.
Well, thank you, both of you. Thank you, Jackie. Thank you, Ali, for giving me that chance to get a little bit more about the company. Like you said, when you read about the company, you think that the organization only focusing on working with correctional or something like that, but there's more into that behind it. There's more support you guys can provide to organizations. Like you say, grants, even though you can hire a grants company to do it for you or someone to come work and do it for you, but having your staff knowing how to do that, I think that's better, because when you have a staff that's handling that, controlling that for you, I think that's a better way to go to keep on reaching out for more grants, especially as an organization you need that, right? So I think that's a very great programs for your company to offer to organizations as well. And also that, I think all the work you have the guys done, not just here in the United States, but also over in Puerto Rico, in a whole different country. So it's amazing to see what you two are doing. And you know what? I don't think women knows what other women are doing out there. The only thing they see on TV is celebrities, right? Mm. But the women that are really making a difference in the world is the woman that's not on TV every single day. So do you know why they are not in TV? Because we are too busy kicking butt out there. So I thank you both for what you do, and I appreciate it.
Thank you. And also understanding that, yes, we work with people in corrections, but like I said prior to starting, they come home. So we actually need to work with the community because they still come home. So, we have the inside and the outside that we can help with. So we know how to do both, which is good, right? Because you have two experiences differently, right? So we could do it both. So yes, but thank you for having us. I truly appreciate this.
So yeah, thank you so much. Think of us as wanting to pay it forward and to help people build that bridge throughout their communities.
Exactly. I love it.
Yeah, and we're getting old, so we like to pass the baton to someone else.
That's it. At some point, my husband's going to want to travel. It's just going to happen.
Yes.
Thank you so much for having us.
Thank you for listening to Female Founders Podcast. That's it for this week's episode. Be sure to follow us on your favorite podcast app or connect with us on womel.com so that you don't miss our next episode. See you next time. Bye for now.